This Medicus Mundi statement is supported by People's Health Movement. We welcome WHO's action to address the impact of climate change on health. However, we are concerned about the absence of urgent action in both documents. The most recent IPCC report highlights the limited time we have to ensure 1.5 degrees Celsius level is not reached. It therefore illustrates the need to take measure in adaptation and not solely in mitigation. As it appears very unlikely that this objective be respected, both documents need more anticipation in the case of higher rise in temperature. The framing of the strategy and the action plan does not address the need to adapt healthcare system to deal with the urgent impact of climate change. Instead, they touch on the need to make healthcare system more resilient to further and ignore the current climate impact on healthcare system that are already being faced by member states, both developed and developing. Furthermore, the objectives outlined in the strategy are very optimistic and ambitious. While we encourage health sector to raise the importance of health impacts with other sectors, these objectives shift the current focus from adaptation to mitigation planning and ignore the need for short-term objectives for member states. Additionally, the vague and broad description used to describe environmental risk confuses the strategy, and the exclusion of formal definition of chemical, biological, physical, and work-related risk further added to its complexity. Using such terminology in this global strategy fails to distinguish the direct risk imposed by climate change on health, thereby diminished what WHO currently labels as the greatest threat to global health in 21st century. We urge WHO to amend the strategy to further clarify the draft action plan for SIDS, to incorporate the need for adaptation measures and produce a contextual guidelines for member states who need to undertake the immediate measure to protect their healthcare system. Thank you.